Hi everyone, today I am at the Bioscience Clinic, which is the world's leading genomic and regenerative medicine centers in Europe and in the Middle East. I will be interviewing Professor Mucci, who has such a vast knowledge to share, especially in the world of stem cells. Without further ado, I would like to invite Professor Mucci to talk to us about his background, how you got into this field, and why you're so passionate about it.
I started 15 years ago when nobody knows what are the stem cells. To work in this field, I built the first cell factory in Italy in 2006 and the second cell factory in 2013 in Dubai. What we did, instead to make the bank from stem cells, we did the cell factory to produce stem cells, to expand the stem cells, and to let our customer free to use the stem cells for a lot of different applications.
Stem cells is something I've been hearing so much in the past 2 years. What are stem cells and what do they do? And why do they have such an important role to play when it comes to regenerative medicine?
First of all, we have to consider that we have three kinds of stem cells. The stem cells that you can find in the cord blood, name is hematopoietic stem cells. It's stem cells that are just good to treat the blood disease. Then we have other stem cells that come from embryo, the embryo in the first days of this embryo. Then we have the mesenchymal stem cells, that stem cells that you can find mainly in the fat tissues, in the adipose tissues, in the bone marrow. Some can be found in the dental pulp or the placenta, but the best source is the fat tissues. Now, if we get these stem cells, what means we can create, we can repair new tissue. The best anti-aging treatment is when you increase the quantity of oxygen in the tissues. And the stem cells is a unique tool that without any side effect can improve the oxygen in the tissues and can make the real anti-aging treatment.
How is your clinic and laboratory different than anything else that is in the region, because you're the only ones that are accredited by the health authorities in the region?
The difference is that there are several doctor clinics. They take the fat, they make centrifugation of the fat. Then after centrifugation, they collect the small part of this fat, then inject this part of the fat. And when they inject this stromal vascular fraction, they say this is stem cells. But this is not true. This is stem cells. This is just misleading, because the quantity of stem cells that are in the stromal vascular fraction, this part of that, are very, very low and are not able to make any treatment, are able just to take the patient to lose his money.
What is the difference between what you do and some other people?
It's very important that to use the stem cells from your body, you need to wait minimum 2-3 weeks. So the first action is to extract stem cells. Then, because we need a lot of million stem cells, we put the stem cells in the incubator with the platelet lysate to rich of growth factor to let the stem cells to grow. When we achieve the enough quantity of stem cells that can be 10 million for the skin, can be 200 million for the lung, then we take these stem cells, so we take 3 weeks, and we extract the stem cells, and we put the stem cells in the refrigerator, in the freezer, just to stop the aging, and then we release the stem cells for several treatments. So the stem cells can be good to treat degenerative process, for disease, for physiology of the aging, but not for any disease.
Some refer to the stem cells treatment as a miracle treatment. In your expertise, have you seen anything where you said, okay, this is really something that is remarkable?
The success rate of stem cells can be 100% total or 1%, because the doctor that uses the stem cells, he have to know how the stem cells work, and he have to make the right assessment of the patient. So it's very important to understand that the stem cells as a tool to treat a lot of the physiological condition, the success rate depends from the right assessment of the patient and not from the stem cells.
The process, you have explained it already briefly, but it's basically taking fat from your body. This is step number 1, correct?
Yes, okay. The first step is to collect the fat from the body. After we take this fat, then the fat arrives in the laboratory. When the fat arrives in the laboratory, the first step is to make the quality control. We need to be sure it's good. Mm-hmm. Then when we have made this quality control, that the fat arrives inside the clean room, in which we start the process for the isolation to extract the stem cells from the fat. Then we start the culture. The culture takes 2 weeks, and we put the stem cells inside a product that are very, very rich of growth factor, and using this growth factor, the stem cells grow. After 2 weeks, we are ready to collect the stem cells from the incubator, and then we repeat all the quality test control. Yeah. Then we are ready to put in the dewar, so in the cryo tank of the stem cells, to stop the aging of the stem cells. And then we are ready also to release the stem cells for the patient.
Does the age of the patient matter?
When the patient arrives around 8 years old, the functional of the stem cell, the proficiency of the stem cells is down around 30-35%. When we're born, we have one stem cells every 2,000. When we have 80-year-old, we have one stem cells every 2 million. We need to have a lot of stem cells for the treatment to give a good result.
So basically the culture is being done in your lab?
Yes, our lab is a cell factory. Cell factory means that we have the totally sterile area in which we protect the stem cells from any kind of contamination.
You talked about IV treatment, you talked about skin and hair. I mean, so what are the different treatments that someone can do at your clinic?
The main treatment in this moment is for hair loss, for hair growth.
The IV treatment, is it for anyone, even at a younger age? If I'm a healthy person and I just want to make sure I take care of my health, what's your advice on that?
The physiological aging starts around 30-year-old. If we make one treatment when we are 50-year-old, we cannot be physiological like a 40-year-old. But we can slow down the process of the aging. We cannot wait to be at 80-year-old to treat our body. And when you treat our body based on the aging or degenerative process, we are prevent also a lot of disease, not just to be more healthy and to be more young.
Exactly. As we prevent. Professor Mucci, is there any side effects from having a stem cells treatment?
If the mesenchymal stem cells are produced in the right laboratory, with the right standard of quality, the stem cells don't have any side effect.
Going forward, what's your expectations in the world of stem cells, and what is your vision about bioscience?
What we know that there is, scientifically speaking, there is a huge impact. We will see that there are in this moment in the world there are 1,460 clinical trials in which they use the stem cells for a lot of different applications.
Professor Mucci, one last question. What's the definition of true beauty?
The definition of true beauty is a natural beauty. Yeah. To be yourself.
Thank you so much.
Thank you to you.
It was a wonderful interview, and I think this is like something that I think will really be very big in the world of anti-aging and regenerative medicine. So stay tuned for more. Can't wait to show you.